Good morning, everybody. Welcome to this webinar on COVID-19 and public health data storytelling. This is part of a series of 3 webinars on the topic of data storytelling that will be brought to you by our trainer, Kuang Keng Kuek Ser. This is part of a larger series that we're doing on data-related topics. Last week, we started with data foundations. These 3 weeks, the rest of June, we have these topics of data storytelling, covering finding reliable data sources, data story recipes, and data storytelling with data visualization. And then finally, we cap it off with a session on data subscriptions and privacy of personal data. That's coming up on in July, so look out for that as well. You will be sharing the registration link shortly. And now, without further ado, I'd like to introduce to you our trainer, Kuek Ser Kuang Keng. He is, of course, an award-winning journalist, digital journalist based in Kuala Lumpur, and he is the founder of Data N, a training program that helps journalists integrate data journalism into daily reporting. Now, he has helped publications like Foreign Policy, BBC World Service, MediaCorp, and Malaysia Kini help enhance their storytelling with data, visual, and interactive components. And Keng is also the competition officer with what used to be called the Data Journalism Awards, which is now called the Sigma Awards, also brought to you by the Google News Initiative. This series of data webinars is also brought to you by Google. Thank you very much, Google. And now, without further ado, let me hand you over to Keng to take it away.
Thank you, Junie. Thank you, WAN-IFRA. Thank you, Google News Initiative, for organizing this workshop for all of us here. I won't waste any time, and I will just straight away share my screen and jump into my content today. Give me a minute. All right. So I want this to be very casual. So if you have any questions, if you have any comments, right, I'll just put it in the Q&A box. I will try to check the box from time to time. All right. So our workshop, the whole series, we have 3 sessions, right? The first sessions, everything is about COVID-19 and public health data storytelling. I know that we are you guys are from many different countries, and some of your countries are still struggling with COVID-19. Some of the countries are slightly better because your vaccination rate could be higher, right? But I think for the rest of the year, probably until next year, some of the countries will COVID-19 will still be, one of the most important issues in many of the countries, right? Because we don't expect vaccination rate to really ramp up, to the whole world by end of this year. But in these sessions, we will also talk about, if you are covering COVID-19, right, then what's next? What's after COVID-19, right? So COVID-19 exposed a lot of things, right? Expose your medical health capacity of the country, expose how your government responds to this crisis, right? And all those things, right? So we are going to use data to help you explore more, dig more about COVID-19 and public health data, and hopefully will help you to create much engaging and much impactful stories, right? Data N is my own company, that we do training, we do advocacy, we do consultation with media companies. Junie has explained just now, so I'll just skip this. So for today is about how do we find reliable data sources online. Not just where are the data, but also how to find the data, right? So there are 4 objectives they are trying to achieve today. One is to, I want you to know about different angles of covering COVID-19 health issues. I'm going to show you examples from all over the world. And next, we'll try to touch on, how do we find and access COVID-19 health data from international data portal. And since you guys are from more than 10 countries, I won't be able to show you all the health data from each country. And I'm not very familiar with, all the countries as well. But I will be sharing with you, some techniques, some tools that you can use to search data, right? We call it a search operators on browser. And the last part of today is, I know that a lot of data from our government are in PDF formats, right? And converting PDF to spreadsheet, right, could be much easier using some tools. So I'm going to introduce 2 tools for you, right? So before going into, the data sources, right? Before that, I would like to touch a little bit on what is data journalism. Probably some of you are not very familiar with data journalism. So in short, right, data journalism means journalism done with data, but that doesn't really tell you much about. So what we are, when we are saying that, when we are talking about data journalism, what we mean is that, we use data as the source of the story, or we use it as a tool to tell the stories, right? So it can be both, right? The source of the story or the tool to tell the stories, right? So just remember this, right? The data can be the source or can be the tool, right? For your storytelling. And what does a data journalist do every day, right? So here are some of the works, right? We need to gather the data, clean the data if the data is a bit messy, if the data is not, there are spelling errors and things like that. We need to clean it. Then we need to organize it, right? After the organizations, we can then analyze to answer our questions or to to find stories from the data. Then at the end of it, when we want to present the data to our audience, we need to visualize it, or we publish it, right? But everything we are doing is for journalism, right? This is very different from data scientists or data engineer, work with, for example, e-commerce company, right? They are trying to understand their audience. But for us, we are trying to produce journalism using data. Just one thing that I wish to remind you is that I will share with you this slides in a PDF format. So you don't have to take notes or take screenshot, because at the end of the workshop, I will share with you a link. You can download the PDF file of this deck. Then why do we do data journalism, right? Just now I tell you, I share with you what is data journalism and what does a data journalist do, right? But now I want to tell you, like, why are we doing data journalism, right? Because data journalism, according to my friend Eva Constantaras, she's a data journalism trainer and consultant with Internews. I like her quotes here, right? She's saying that data journalism is harnessing data to measure a problem, right? So you want to know how serious a problem is, you need to have quantitative information to measure it, right? And using that quantitative information or data, you can also identify who has been impacted, what is causing the problem, and what the solution might be, right? So data is very powerful here, right? It allows you to measure the problem, find out who are impacted by the problem, the causes of the problem, and also what are the solutions. So currently, very little journalism is based on this type of what we call scientific research-based methodology, right? And this methodology is not just to report about an issue, it's trying to uncover the root of the problem, right? So let's say, I'll show you some examples that to show you how data can be used for this purpose. So before going into those examples, just to share with you some background, right? We know that COVID-19 pandemic started last year around January in China, and then it expanded to the whole world. In my country, Malaysia, we went into lockdown in March last year. But although this is a crisis, not just a public health crisis, it's an economic crisis. But for a news side, right, but news publication, right, there's a silver lining behind it, right? Because the consumption of news, especially online news, right, has increased because of the pandemic, right? Because people want to know more about the virus. People want to know how the country is doing, how different governments are taking actions to address the problem. So because of that, there's a very strong desire of, finding information. And this has brought us new audience, right? Which means that I think if you're in the newsrooms, probably your traffic has increased in the past 1 year, and you are able to, meet with more, you are able to reach more new readers or, users or consumers of your information. The same trend in Southeast Asia, right? These are the two statistics for Indonesia and Singapore. It is only until March 2020. I can't find latest data yet, but the first chart showed us that the trend has maintained from last year March until July. Okay, we still need more information for this year, but I believe, right, this year people are still looking for information because of the vaccination. People want to know more about vaccinations and issues surrounding the vaccination. Right. However, I think it is time for us to move our COVID-19 focus, our coverage focus, right, from the virus, for example, the number of virus, number of new cases, things like that, to who are impacted, right? So before that, when the pandemic first started, right, we are very good at doing daily updates, right? We tell people how many news cases today, how many tests have been done today, and things like that, right? However, I think we need to focus more on, the people, right? The people who are the most impacted communities, right? How bad are the impacts? And is the government response effective in helping the vulnerable people? And the other thing is that this one, a lot of people miss this, who capitalize on the vulnerable, right? The vulnerable are suffering, and some people benefit actually from this whole pandemic. And who are they, right? Our coverage can uncover, these people, and to shed more lights on people who are suffering, people who need our attention and help. So let's look at some examples from all around the world. This is a very good article. Later, you will get the link when you download the PDF for this deck. It is talking about the coronavirus coverage, right? Giving a voice to the vulnerable, okay? Using data, okay? Some of the stories mentioned in the article, just want to show you here. New York Times, there's a story about how the pandemic are, putting people back into poverty, okay? The same thing happened in Taiwan. This is from the Commonwealth magazine. This is a report also about, the pandemic would again redistribute the wealth, and the poor will suffer more during the pandemic. The BBC doing the same thing. We also have The Guardian on Italy, right? The rising poverty in Italy because of COVID-19. This is the story by Commonwealth magazine from Taiwan, and you'll see that this is showing you the red line is the wealthiest community. The blue lines are the poorest group in Taiwan, right? And you see this happened during the financial crisis. This is the SARS. This is the the internet bubble, right? So you see that whenever there's an economic crisis happening, right, the rich would become richer, and the poor will become poorer, right? And they do this, the second graph here, they do it until 2018. So they don't have the data for 2020 and 2021 yet. This is something that, we should continue to pay attention to, right? What has the pandemic done to your economy, to your wealth distribution in your country? Who are the groups that are most impacted, right? So using those data, right, the wealth data, right, is able to show you who are impacted, right? And The Guardian has a series of stories, right, to use data to measure, to tell you that, the BAME community, which means the Black, Asians, and minority ethnic, are the hardest hit in London and in UK, right, and in other countries, and in UK, right. So these are they're using data to measure the impact of the pandemic. I want to show you this story from the New York Times. It's very I like this story a lot. Let me show you that here. Location data says it all. Staying at home during coronavirus is luxury, right? So this story, it used the mobile data, okay, of Americans, okay? So because your mobile data, your mobile phone records all your movement data, right? When did you leave home? When did you come back here? And how far you travel? And whether you're staying home or you're going outside, right? Your mobile data has the geolocations function enabled, and it will send this data to the telecommunication, the telco companies. And using those data, they're able to detect your movement, all right? So using that data from the telco, New York Times tried to do an analysis to see how fast can people stay at home without going out, okay? Because we know that if the faster you are able to stay at home and the longer you're able to stay at home, you are safer, right? However, there are people who are forced to travel because they have to travel for work, because they are part of the essential service industries, right? They still have to travel. But because of traveling, they will have a higher risk of getting the virus, right? So this New York Times stories it shows you the line when people start to stay at home. When the line goes down, it means that people start to stay at home, right? The line in the middle here, this is what it's called. This is a neutral line. Neutral line means that you travel like normal life, right? You travel like normal, but after the lockdown, people try to stay at home. So you see that the movement line go down. Okay. So you see that beginning in early March, people across the country started limiting our movement. Right, this is early March, March 1st, and around March 8th, you'll see that people limit their movement and stay at home, right? Okay, now there are two different colors, right? One is a blue color line, the other is a orange color lines. And the blue color line means the top 10% of the wealthiest people. The bottom 10% is the poorest, right? Poorest neighborhood, all right, or communities. And each line represents a different city or town in the US. So now you see that when the President Trump asked people to stay at home, those in the wealthiest and poorest area were moving less than usual, right? They all start to move less and stay at home more. However, the highest income locations, right? Those staying in the highest income locations, wealthy neighborhoods, are able to cut their movement by half, okay, from here to here, okay, by March 16. However, people from the poor areas, right, they are only able to cut their movement by half here 3 days after, right? Which means they still travel more in those 3 days, right? Compared to the wealthy people. So this shows you a gap in the response against the virus, right? The rich people have more, are able to stay at home. They have better, conditions. They have better opportunity to stay at home compared to the poor, right? So this is a gap between the poor and the rich. So you just scroll past it, you'll see that the same trend happens in different cities, different metropolitans in the US, okay? You see that the blue line always go down faster than the orange line. So this goes back to our definition of data journalism, right? You're using quantitative information or data to try to measure an issue, right? And this case, it is trying to measure what is the response of the poor people and the rich people, right? Response against this coronavirus, right? So you will see that there's a gap, on how fast they can lower their movement, okay? So this shows a gap in the society. And they are able to prove it, like this happens in all different cities and areas. And you'll see that this is the gap. Each metropolitan areas. All right. So that's one story that I think has really harnessed the power of data to measure something, and it's not just to tell you that, oh, people are not, going out, more of them are staying at home, but it's telling you that, there's a difference, right, in the response. This another story that I like a lot is the story by, I think it's by, what do you call it? Let me show you the story. It's called the Marshall Project. Yeah, the Marshall Project. It is a website that focuses on prison in the US. Okay, I think during pandemic, right, we don't really pay much attention to the clusters in prisons, right? But because of the very crowded situations in prisons, usually if there's a cluster there, it could, grow very, very fast, right? But nobody really pay attention to these people because, well, these people are, prisoners, right? And people don't care about them, right? Because they are not very, how do we say, they are humans. But people would think that, these are the people who have have done something bad and were put into the jail, right? But they are people as well, right? So this, the Marshall Project actually spent a series of reports on the situation of the coronavirus in prisons in the whole US. So you see that it will tell you that which prisons have higher highest number of cases, and also which prisons have restricted visits during the pandemic, right? And the middle story here, there are a lot of human stories about, the people who, prisoners who die from the virus, okay? So this is another a good example of how can we use data to tell the stories, right, of marginalized communities. I know that those are the stories happen during pandemic. Some of our countries are already at the end of pandemic, right? But some of our countries, their pandemic has just started, like Taiwan, okay? In Malaysia, we are at the peak of our pandemic, right? So these stories are still very relevant, right? Stories of who are most affected. If you're looking at the death data, right? The people who die, where are they from? Are they from the rich community or poor community? And whether they are from a certain ethnic groups, right? So those are pertinent questions that we can explore using data, right? If you can get the data from the government, right? Depends on each government. Some government share more data on COVID-19. Some government, they don't share a lot of data, right? So currently there's another important thing that's going on during the pandemic, which is the vaccination, right? So when we're talking about vaccination, it's the same for the virus. The vaccination, we also have this inequality, right? In the unbalanced distribution of vaccinations, some people are able to get the vaccine, some people are not able to get the vaccines, right? So New York Times here done a very good story. Let me show you that story. Who can and can't get vaccinated right now, right? This is done in March, 3 months ago. So it has a very interesting presentation of the story. It is not in a paragraph, but it is in different short sentences. So I just scroll through, you have a look. And they collected data about, vaccinations in different countries. And what they found is that, these countries, right, have not reported any vaccinations by March this year, right? So, which means these countries have 0 vaccinations, okay? And you can look at it, most of them are in the continent of Africa, right? Some of them are here. This is Papua New Guinea, right? So those are poor countries, right? And they don't have any vaccination. So if you scroll down, they will tell you that the friends of the mayor are able to get vaccinations, lawmakers, military leader, and the extended family of the deputy health minister. So you see that these are people who are elite or who are close to people in power, right? So a diabetic in UK can get it, a diabetic in Connecticut can't get it. You scroll further down, there are 2 more maps here that use data to tell you the gap here. These countries, the advanced and rich countries, they are going to finish their vaccination in 1 year, okay? But these countries, right, most of the other countries, right, in Asia, in Africa, in South America, right, they will take 1 year or more to finish their vaccination. So just to remind us, right, if they don't finish, you can see that those are most of the countries that if they don't finish vaccination, the whole world is not safe, right? So this is this is the end of the story, right? So these stories use data to tell you the vaccination gap, right, among different countries, right? So this is international. What about domestically? These are some of the this one story on the right hand side. This is about domestic vaccinations gap or inequality. So let me show you this story. Pandemic racial disparities, right, in the vaccine rollout. So they track, people who are getting vaccinated and what is their ethnicity, right? Whether they are white people, black people, or Hispanic people. So they are focused on the black population. So I'll just show you. This is, the black shares of the general population, right? Which means how many population in those states are black. And these are the percentage of how many of them got vaccinated, right? So you can see that black people usually get vaccinated, right, in less than their percentage in the population, which means that, less of them, a few of them, right, get vaccinated. So you can see that they use data to tell you, how big is the gap. So again, this is back to, the measurement of the story, or the measurement of the issue using data, right? So you can have the links later, and you can look at those data, those stories by yourself, and probably they will inspire you to do similar investigations in your own country. Another two stories. This is from Canada, and this is from Germany. This one shows you, right, this map is the map of Toronto, Canada, and it shows that this shows you the hospitalizations as death, right? But when it comes to vaccination, right, the areas in the middle here, right, they are less affected by the pandemic, got the highest rates of vaccination. This area, right, on the left-hand side, right, you see that they are more impacted, right, most impacted during the pandemic. However, they get low vaccination rates. So what is the factors and why there is this inequality, right, in this, in the distribution of vaccinations, right? So these are all very important questions that journalists should explore and point it out, and hopefully the government will then take action to address them, right? This is another very interesting story. It's accessibility of COVID-19 vaccination centers in Germany, right? It measures how long you have to drive to reach a vaccination center. This is the same problem that Malaysians are facing now. I'm not sure about other countries, right? In Malaysia, some of us, and especially in the rural areas, people have to travel 40 kilometers or more to get to one vaccination center to get vaccinated, right? So imagine if your parents are in the 70s or 80s, how do they, how can you expect them to drive for 40 kilometers? 40 kilometers could be, half an hour or 45 minutes, right? Depends on the road conditions, to go to a vaccinations center, right? And this shows you, the disparity in Germany, okay? The light colors means, they are very close to vaccination center, but the dark red means that, especially in this area, you see that they have to travel very far to get to the vaccination center, right? And they use an algorithm to calculate all this different distance. Right. Just now we talk about COVID-19 data, and we talk about vaccination data, right? The next thing that we could, do now, after the pandemic has been going on for more than 1 year, we can look at the medical capacity of our countries, right? Whether we have enough hospital beds, whether we have enough ventilators, right? Things like that. And should we improve that, right, in the coming years, right, to prepare for another crisis, another public health crisis, right? COVID-19 pandemic has exposed a lot of weaknesses in our public health system. And I think it is time for journalists to highlight that, right? And so that to push the government or other stakeholders, right, to take action to plug those holes before we, have to face another crisis. So here are three stories, right? The first one is about how many ventilators in Nigeria. There's only one ventilator for every 1.2 million of Nigerians, right? This is done by DataFight. DataFight is a data journalism outlet in Nigeria. This is done by Mexico, by an organization called Tucan. They are looking at the beds that would be occupied, right, if the infection rate goes up. Okay, they look at different scenarios, and they look at the more vulnerable areas. You can see that. Okay, and the last one is from India. This is done by I think from India Today, right? It is looking at the status of health infrastructure and change between September 22nd to January 28th, right, this year. Okay, this story is actually telling you that before the I think the third wave hit, right, which is the current wave, right, and it is the most challenging wave. And a lot of patients, we all read from news, a lot of hospitals are running out of oxygen, right? And just before that wave hit, right, Indian hospitals actually decreased their capacity. And that is one of the reasons why this current wave, is so fatal, right? So they go and find the data, and they use they use an interactive map to show the data. Let me see if I have that story. No, let me just open up that story for you. It's from India today. Just before the second COVID wave hit India, ICU beds decreased by 46%, oxygens by 36%. So they show you this is the second wave of the pandemic, right? And you can then look at the change in oxygen beds, the change in ICU beds. And you can see that these states, right, they actually decrease the beds of ICU, right? Change in ventilators, right? Most of the states here, they actually decrease their numbers of ventilators, right? So this is the investigation about why that happened. Okay, so this is one way of using data to look at previous conditions and look at decisions that are made by government. But we can also use data to look at the current medical or health capacity of our country, whether it is enough for this pandemic. Most of our countries like Malaysia, we have our ICU beds have been occupied more than 100%. So it is obvious that ICU beds are not enough in this country, right? If we are to face another pandemic like this one. Okay, so these are the questions that journalists should raise. Okay, in many of our countries, right, I want to talk about this problem about lack of data, right? I know in many of our countries, our government don't share data. So sometimes you have to be creative, right? But also be very careful when you're trying to use, data to indirectly measure an issue, right? So this is a good story. This is about the death in Jakarta. So when COVID happened, right? This is in last year, April. Okay, last year, April. I'll just show you the story. This is done by Reuters journalists in Jakarta. Okay, they don't have access to number of deaths in Jakarta or in Indonesia, right, as well. So they are trying to measure, right, how many people die from COVID-19, right? But the government doesn't give you the number of deaths, right? And they suspect that the COVID-19 death data given by the government is not accurate because a lot of people, patients, they die without being diagnosed. So they could be dying from COVID-19, but because there was no diagnosis, because they die from home, right, at home, right, they were not diagnosed by doctors, so they were not counted as COVID-19 death. Okay, so the official death data, COVID-19 death data by the government could be inaccurate. Okay, so to measure the real death caused by COVID-19, what they did is that they collected the data from the, I think this from the, let me see, from this Jakarta's Departments of Parks and Cemeteries. This department shared data every week about how many funerals, okay, were done in the city of Jakarta. See, so they collect the data. This is funeral services, right, shared by that department. And you'll see that from January 2018, right, this usually the death is around between 2,000 to 3,000. Sorry, not death, the funeral services, okay? But in March and April 2020, the funerals increased by almost double, right, to over 4,000, right? So these are, why do we have a sudden surge of death here in these 2 months? It is because of COVID, right? So using this number, they're able to estimate that, right, the real death caused by COVID, right, could be this number, right? Which means you take the 4,422, right, minus by the average, monthly death, then you will see, this is the COVID-19 death. And this is actually a better data compared to the government, because the government could be underestimated because of no diagnosis done to those who have died, right? So when you don't have the number of death from the government, and you don't think that the government COVID-19 death is reliable, right? How can you prove that, right? You look at the number of funeral services in this case, right, to estimate that there are excess death. We call this excess death, which means that deaths that happened that were much higher compared to the previous average data. Okay, we call it excess death. Using this same approach, right? The New York Times used the same approach to measure all the excess death in different countries, mostly in the Europe. So you can see all this chart, right? Because again, a lot of death caused by COVID were not recorded by the government. So they need to look at the national death data, right? Like how many people die on that month, and they compare with historical average, and you will see that there's a surge. This is a more accurate data of the deaths caused by COVID-19 compared to the official COVID-19 death data, right? Again, because the reason is that a lot of people die without diagnosed, and because they are not diagnosed, probably they got COVID-19 because they are not diagnosed, so they are not in the official COVID-19 death data. Okay, so you can see that the New York Times and also Financial Times also did the same. They use the same methodology, looking at the recorded death in the whole country on that month, and compare it to the previous average. All right, this is another story done by Reuters as well in Ho Chi Minh City, Vietnam. During the pandemic, right, they want to measure how much the pandemic has affected the movement of people, right, the movement of residents in Ho Chi Minh City. So instead of course, the government won't give them data about the traffic, right? So they got the data actually from the Waze. Waze is a mobile app that you use to drive, to navigate the traffic, right? When you drive, you use Waze. I always use that when I drive, so that I can go from one destination to another destination, right? So they use that data, and they're able to show you that this is before and this is after the pandemic. I'm sorry, during the pandemic, right? And you see that also when you don't get traffic data from the government, right, and nobody is having those kind of data, think about which company, private firms that might have the data, right? So look at your mobile phone. One of the very good tip is to look at mobile phone and see which kind of apps actually record that kind of data. So driving data could be recorded by Google Maps, Waze, or any other driving navigation apps that are popular in your country. Okay. So the point here is that when there's no data, think about be more creative, right? Think about we don't have to always rely on government to get data, right? There are data from private companies, there are data from researchers, there are data from NGOs that we can use. So think about different data sources. Right. Any questions so far before we move into another sessions? Let me see the Q&A box. Oh, it's empty. So everyone is okay. We have 50, I think I have 50 something people online now. Thank you, Cheryl. Yes, should you have any questions, kindly put them into the Q&A box. Or you can raise your hands, unmute yourself, and yeah, talk to us. Right, if there's no questions yet, then we'll go for the next part of today's session, is where to find data. Just now I showed to you, different ways of using data to report on COVID-19 or to report on health issue, right? But the next thing the next question is always, okay, I want to do this reporting. So where do I find the data, right? These are all the usual popular COVID-19 data available for all countries, right? They're all free. And I think those of you who are reporting on COVID-19 has been using the data from here. But for the benefits of those who have not, who are not very familiar with COVID-19 data, I'll just show you very quickly. The number one source that everybody uses is from the Johns Hopkins Coronavirus Resource Center, right? They even have visualization for you to embed on your desktop or mobile phone, right? And they also have raw data that you can download and do your own analysis. They have data of all countries, so you can actually do comparison, all right? And they also have, their data are in different sources, right? There's one, the raw data is here. There's also in data.world, which is a a Facebook for data sharing, right? It's like a Facebook, but of course it's not a Facebook, but it's a platform that looks like Facebook, but that enable people to share data, okay? And they Tableau is a data visualization software, very popular. They also developed a COVID-19 data hub using the data from Johns Hopkins Center. Okay, so let's look at those some of those resources. So this one is the dashboard by the Johns Hopkins Center. You can actually embed this straight away, embed this on your desktop. Okay. You can also go for the mobile version. This is the mobile version. So you can see that why it is mobile version, because it is supposed to look like this on mobile. Okay, so it's different from the desktop version. This is the desktop version. Okay, so you can straight away embed those graphics in your story using the embed code. And I want to show to you, this is a special tracker for Southeast Asia. I know most of our participants here are from Southeast Asian countries. So you'll see that, you know, they are comparing different Southeast Asian countries. Okay, they even look at give you the GDP growth, right? And you can look at different countries here, all Southeast Asian countries. Okay, and they will tell you the responses, you know, in from each country, right? Until the latest one. So if you want to compare different responses, you might want to look at data here. All right. There's a tracker archive. Okay, here. They have this weekly tracker update. So every week you can come here and look at, you know, what are the weekly updates about Southeast Asian countries. This is especially on Southeast Asia. So I think it's very useful for Southeast Asian journalists here. Okay. And there is all these links will be available when you download the PDF later, and you can, you know, have a look at different sources here. Then there is this also, I also compiled a list of government responses data, right? These are all the links that tell you how government responds to the pandemic, right? Whether it's a lockdown, whether it's, you know, closing of schools and things like that, right? There are all these different trackers, right? That, you know, track what have each country done. Okay, I want to highlight one. This is called mobility report. One of them is from Google. I think Apple has a mobility report. Google has also the same report, but I think Google is more popular in this region. So Google data might be more accurate for our region. So let me just show you what is this mobility data. Oh, before that, yeah, this is the Johns Hopkins University. This is the raw data. You'll see here. Archive data, CSSE data. So when this is called GitHub. GitHub is a platform for people to share coding and also data, right? So if we go into COVID-19 data, so you'll see that there are daily reports. This is for US, this is for the whole world, and you can then download as a CSV. See, there are different CSV for different days. Okay, CSV is a data file. Okay, so this is the Johns Hopkins, the raw data on GitHub, where they update every few hours. Or you want to look at a more user-friendly platform, which is called data.world. As I told you, it's like Facebook, but for data sharing. You can go into COVID-19 activity, and you will see that, you know, there are data here that you can download. Okay, but you have to create an account and sign in, right? It's free. It's like Facebook. Everybody can create an account and use the platform. This is the compilation by Tableau. Tableau is data visualization software. And again, all this, you know, are free. So they even allowed you to download the whole this dashboard on your computer if you have a Tableau account. Tableau has a free version that you can install, and you can then download this tracker on your own dashboard. You can also show it on your website if you want. Okay, but these are all for COVID-19. Okay, so just now I want to show you the Google mobility report. Okay. This is Google Mobility Report. So what is this data, right? This data shows, how much your community moved, right, during the pandemic, okay? It uses mobile data, okay? It uses mobile data from each country. For some countries, they even have, regional data. For example, for Malaysia, there are different regions for Malaysia. Let me just show you. There's English, Malay. If you download, then you will get data for different states in Malaysia as well. Okay, this shows you. Let me show you the chart. Sorry about that. So it shows you, if you get the data and you plot it into chart, right, it will shows you how much people reduce their movement or how much people increase their movement, right? And it is updated every 3 or 4 days, okay? So you can see that it is until June 14, which is 2 days ago, the data was updated. So using this, you're able to show people whether the lockdown is effective or not, because the purpose of the lockdown is so that people don't move, right? So if you implement a lockdown but people still moving, right, which means that your lockdown is not very effective, right? So this data will help you to tell that story. Okay, let me see if I can find an example. Google Mobility Report, Malaysia. Oops. Here, there's one story done by Malaysia Kini, is to show you, this was in 2020 April, is to show that the traffic for, you see here, the traffic for retail, recreation, grocery, pharmacy, parks have dropped. Okay, right, they did not make the data. Let me show. Here. Yep, you can see this data. Okay, this is the lockdown in Malaysia in last year March, right? After that, after that people were moving back, right? And you can see that this is a second lockdown. But after that, we loosen the lockdown and people start to move again. Okay, so this data are actually from the Google Mobility Report, right? And this is free, right? So everybody can download it, the data, and do your own analysis. This is pretty accurate because a lot of people are using Google Maps or have Google Maps on their handphone, and the data is based on those who enable geolocations on Google Map. Okay, trying to adjust my browser. Okay, cool. This is something that I like. I like to use every few weeks to look at how the movement had changed. They have subgroups like the traveling to pharmacy and retail, grocery, to parks, to work as well, right? So this will tell you, show you a very good picture of how people move during the pandemic or during the lockdown. Then these are all COVID-related data. Okay, the hospital bed capacity in Asia countries. Excess death, just now I mentioned, New York Times have done that, the economists have done that, and there's a human mortality database that is also shows you, the mortality rates in different countries, but not many Asian countries are included here. We only have Taiwan, we have Hong Kong, right, Japan, but not Southeast Asia, I think, right? Then, if you are interested in reading the scientific papers about COVID-19, there's a COVID-19 preprints, right? However, just a reminder that these papers have not been peer reviewed, okay? Because we are in an emergency, so scientific paper will be published, urgently, right? Without a lot of reviews before, and then they will just publish it. So they have not been peer reviewed. So be careful when you are quoting this report, because they might not be, tested. Use that cautiously. We have an ILO about impacts of COVID-19 on labor markets. This is also a good database. Okay, COVID-19 and labor statistics, because we know the impacts of the pandemic on the labor markets is huge, right? So here are some data that you can get, okay, about labor conditions in different countries during the pandemic. The NASA data Pathfinder is interesting for those who are interested in doing environmental reporting. This is NASA has compiled this data sets to show you the environmental impacts during the pandemic, because human activity has reduced, so it has impacts on the environment. And what are those impacts, right? These are the website that you can access those data. All the data here are free, okay? There are also, if you want to report about education impacts of the pandemic, then here's a COVID-19 data by UNICEF, right? You see that there are interactive data visualizations, there are publications that tells you what happened to children's and educations in different countries during the pandemic. Okay, there are some useful data here. Okay. The UNOCHA, this is about humanitarian aids, right? If you are interested about refugees, about conditions in Myanmar, here you might be able to find some data. Okay, global health data, this is nothing to do with COVID-19. This is just general health data. If you want to report on global health in your country, or you want to compare what happened to certain indicators during the pandemic, right? You can use this health data. These are very important data sources, because you can use them even during, even during non-COVID time. So let me just show you. Yeah, this is one of the most comprehensive database on world health, right? This is compiled by WHO, and you're able to find different data here. Okay, let's say you want to look at alcohol or adult mortality rate. Okay, let's look at this. Adult mortality rate by country. You have to wait for a few seconds, for the data to come out, right? So when they show you the data, so Afghanistan, different areas, oops. Okay, different countries, right? The mortality, okay? Probability of dying between 50 and 60 years per 1,000 population, okay? I am guessing that this will increase, these numbers will increase for 2020 for most of the countries because of COVID-19. Okay, then you can download the data as CSV table, or JSON or Excel. Okay, but CSV and Excel are the most popular formats that we use for data. Okay, so this is how this is very easy to use, because you just have to look at all the different indicators here, right? Click on one of it, and then you can look at data for different countries. However, not all countries submitted their data to WHO, yeah? So you won't be able to find data from certain countries. That's quite normal. This is the WHO. The other one I want to show you is from the Global Health Data Exchange. This is actually developed by an institution in a university, the university in Washington State, US. Okay, so this is also this is slightly more complicated. Okay, but you can search for what data you want. So you can see death, disability, adjusted years, blah, 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 right? So this is for the, what do you call it, life expectancy data. For GHDX, right, they have different data as well, but we are looking at the GBD results, right? GBD is for the life expectancy result, but they also have about data, other data here. Okay, just to show you that how do you get the data from this interface, right? So you just have to select locations, which country, okay? So let's say I go for Japan. Okay, and then you select year. How many years? Okay, let's say you wanted 4 years of data. Okay. This is the other filter that you can use. Age group. Okay. Metrics, they're all selected, so you don't have to change that. Sexes. Then after that, you just click download CSV. Okay. However, you will not get data from this website. The link for download will be sent to your email. So you need to click this box, right? Put in your email address and you tell them that I want this data, and they will send the link to download the data to your email. And you can download from there. It usually will take a few minutes for the email to arrive in your mailbox, right? So don't worry about it. Okay. So this is also very good database on several health indicators that you can get. Oops, let me go back to my presentations. Yeah, so these are some of the database. Oh, there's a WHO. Just now I show you the database that, sorry. Sorry guys, I have to wait for the top menu of the Zoom to go out. Okay. Here, right, Global Health Observatory, GHO, right? WHO also provide GHO database in different formats. For example, sorry, this is the one that I show you. There's a second one. This is the second one. It is probably look more beautiful. I seldom use this database, but I know that they give me the same data as this one. Okay. So you search for, just now we search for mortality, and you will get. Then you can choose here, right? And you can also download the data from here. Okay, so these are all global health data from WHO. This is useful when we want to compare, let's say, my country with neighboring countries, right? To see the impacts of, could be the pandemic. We just want to look at long-term developments of the health capacity or health indicators in different countries. Right, some of the useful data, but they are not related to COVID-19. I just included here so that in case anyone wants to look at the data. The first group is about import-export data. You can get free data from, UN Comtrade, right? It's free. WTO is free. Panjiva is paid database. It's quite expensive, right? You're able to track the import-export of supply chain. For example, you want to know how many ventilators you imported, how many hand gloves, how many face masks your country has imported during the pandemic. You're able to find the data here under UN Comtrade. You can also look at, let's say, during the pandemic, right? The disruption to the supply chain. For example, you used to import certain products from certain countries. What happened during the pandemic? And also look at whether the government are able to continue with some of the policies during the pandemic, right? For example, Malaysia has promised to stop the import of plastic waste, right? Last year, but the data shows that we are still importing a lot of plastic waste last year during the pandemic, right? So these are the things that you might be related to your investigations. Global Forest Watch, this is record forest change by looking at satellite images, right? So the use case might be you want to look at deforestation activities during lockdown, right? During lockdown, usually deforestation activities will be stopped, but if people are still continuing with deforestation, then those are illegals, right? The illegal deforestation, how do you detect it? You can use Global Forest Watch to look at that area. It has a very high resolution. You can look at areas of 30 meters times 30 meters, right? Very small area. NOAA is a US new agency that has global climate data, right? So you want to investigate the impact of lockdown on temperature, on air pollution, right? You can look at NOAA data. We also have Global Fishing Watch to track the commercial fishing vessels in your water. to see how the pandemic probably has impacted the fishing activities. You want to look at the change of fishing activities, how many fishing vessels. You can look at this database, and also wildlife seizure data. Right, this is related to. I think this is very relevant to Vietnam, because Vietnam has been is a huge one of the major traffic points for wildlife, illegal wildlife. Right, same for Malaysia as well. Right, so far, any questions before we move into the more practical part of how do we find data? Okay, still empty in the Q&A box. All right, so in that case, I will just continue. Hold on, guys, I'm trying to close the Q&A box. Okay. You won't see that, but it's only on my screen. Okay, cool. I can continue. If the data that you're trying to find is not in one of those data portals that I have shown you, right? How do you do with that? You need to search for yourself, right? Especially when you are searching for domestic data, right? Like your government, the data released by your own government, you're going to search for that. So there are more efficient way to do search. If you know, the search operators that you can use to limit or narrow down your search, it will make your search more efficient, right? I think some of you might already know this, so I just show you for those who don't know. I think Google search is the search that everyone is using, all right? So there are this thing called Google search operators, right? That helps you to narrow down your search to make it more efficient, right? So the first operator that I want to show you is called cite. There are three I want to show you, right? One is called cite. When in your search phrase, right, when you put in cite column, then you put in a website, right? Or you put in cite facebook.com, right? Remember, don't put www in front of it. Then you're telling Google that I just want you to search within this website or within this domain, okay? So you don't search anything outside of it, you just search within this website, okay? You can also tell Google that I want to search for a certain file type. Let's say you can put file type column PDF, which means you only search for PDF, right? If I'm not searching for a website, I'm not searching for any other file, I just want to search for PDF files in PDF formats, okay? So PDF is useful when you want to search for government reports, right? A lot of governments like to publish data in the report, and the report is usually in PDF format. So in this case, you are able to search for that PDF. CSV, XLS, you can also use file type CSV, XLS. This is to search for CSV or XLS, and we know that data usually are stored in CSV or XLS or XLSX. This is a newer version of Excel spreadsheet. So the other in URL is not very important. You can also use setting and tool to specify time and language, right? And there are other Google search tools. So let me just show you. I'll show you the Google search tool first, and then we'll go into some examples of how to use these search operators, right? So this is called Google Public Data Explorer. Okay, what happened is that you are able to search for public data here. Only data that are from verified sources, for example, from international organizations, for example, from universities, will be listed here, right? So data that are featured here that you can search here is usually data with high reliability. Okay, remember that. So you can see that there are data from World Bank, World WEF, IMF, World Trade, and blah, blah, blah. Right, so you can search the data here. So for example, I want to search for mortality. Yep, you'll see the different data here. Yep, and the other good thing about this search search engine is that it shows you the visualizations. And not only that, you can actually embed the visualizations here. Here, if you get this link, HTML link, it's an iframe code which allows you to embed it in your website, right? We'll talk about this more on the third sessions about visualizations, okay? So this is the Google Public Data Explorer. Google Scholar, I think most people know Google Scholar. This allows you to search for articles, research papers, right? Things like that. So it is very useful to search for disease. Yeah, you'll see that there are different academic papers. You see that who authored, who produced the papers. Okay. This one is called data set search. This is a new tool introduced by Google a few years ago. It allows you to search for just data. So let me just put Singapore. And they only feature data from reliable sources. For example, Trading Economics, Statista, or the Singapore, the CEIC data, right? So these are all data sets that meet the criteria set by Google, right? So usually you will get reliable data from here. However, it also means that if your government data doesn't meet the criteria of Google, it will not be shown here. Okay, so this is just for you. This is like for me, it's like my preliminary search. I will search for here. If it's not available, then I have to do my own Google search. Okay, but I'll look at here first. Data set search. Okay, so you see that they are all from reliable sources, right? But again, when you click on those, you still have to like double and triple check your data, right? Every time you get data from somewhere, you don't just believe it 100%. You still have to look at it. Usually there are some caveats or some information about data. Make sure you you read all those information before you use the data. Okay. Right, so let's look at some examples of using Google search operators. Okay, so the left example, the example on the left, I did not use any search operator. Example on the right, I use search operator of site. What's the difference? I want to search for the R0 from Malaysia. R0 is the infectivity indicator of COVID-19. When the R0 is above 1, that's very bad. If it's below 1, that means you're flattening the curve. Okay. So on left hand here, the first example, I just searched for Malaysia and R0 because I want to know the R0 from Malaysia. So look at the results I got. I got the agemarket.com, which is a media publication. I got Code Blue, Gallen Center, another media publication. The third one, Astro Awani, is one of our TV stations in Malaysia. So I got all the data about R0 from media, right? But I actually want the data from the source. Who is the authoritative source here? That is the Ministry of Education, Ministry of Health, right? In Malaysia, it's MOH, Ministry of Health. So in that case, I will put in the search operator of site, SITE, column moh.gov.my. moh.gov.my is the official website of the Ministry of Health, right? Then only I put in the keyword R0 in double quotes. Double quotes means that I want R0, right? The whole phrase, not just R or not, but I want R0, okay? So then you'll see that all the results here are from moh.gov.my, right? It could be www.moh.gov.my. It could be COVID-19 moh.gov.my, right? But I'm telling Google that I just want you to search within the domain or the website of moh.gov.my. Don't search outside it. So in this case, I will be able to get R0 directly from the Ministry of Health instead of looking at media, right? God knows media might make mistake, right? God knows media might, So it's better to get the data from the original source, right? So this is how you can use this operator. Okay, the next example. I want to find the budget speech of Singapore. Singapore government announced budget for 2020. Every time when they announce a budget, the finance minister will make a speech, right, in the parliament and present the budget, right? So I want the speech. If I just search for this one, Singapore budget speech 2020, without any operators, I will get, there's a dedicated website about the budget. It's called singaporebudget.gov.sg. Okay. And here you will see that there are different part of the budget, right? And of course, budget speech is here. You can click on here, right? So, and also I will get data about from Channel News Asia, from Straits Times, usually those from media publication. But if I put in Singapore Budget Speech 2020 file type PDF, okay, you can put a search operator in front, in middle, or at the end of your search phrase. Doesn't matter, right? As long as you put the search operators, and remember that there's no space after column. There's no space. Okay. I put file type PDF, so which means that I'm telling Google I just want to search for PDF files. Okay. Don't give me website. Don't give me any other thing, right? Then straight away, the first search result, right, gives me the budget 2020 advancing as one nation. This is the speech, budget speeches. Okay, so this is PDF. You can see that all the results are in PDF because I tell Google that I only want to find PDF. So this is how you can use search operator. Okay, right now is your time to do some simple exercise. So I would like you, if you're on your laptop, right, to use Google search operators to find government source or document that states the latest maternal mortality rate of your country. Maternal mortality rate of your country. The latest, probably it could be 2020 or 2019, depends on how fast your government updates the data. But I want you to find government source. I don't want data from WHO, right? I want you to find from your government source, like government reports or government documents or government websites that tells you the latest maternal mortality rate. Remember, try to use your Google search operator, all right? Let's do about 5 minutes. And you can share with me if you are able to find it. If you can share with me what are the operators that you have used in your search. Try to use site or the site or file type. All right, guys, time's up. Anyone able to find the maternal mortality rate of your country? Anyone want to share with us how did you find it? Anyone? No? We have a very quiet crowd today. Okay, cool. Some of them has put it in the chat box. Okay. Fang Kailu said that he used a site gov.my. So you are from Malaysia, I guess. File type PDF and maternal mortality. Okay, let me try that. Okay, let's do this. So guys, I just opened my Google. So this is how you can do it. Site, right? It doesn't matter whether you put it in the front, in the middle, or the end. Okay, so you can put it everywhere, right? Just make sure that there's no space. Okay, site gov.my. So gov.my means that you are searching all the websites ending with gov.my. It means all the government websites in Malaysia. Okay, all the Malaysian government websites. Sorry. So it includes moh.gov.my. It includes MOE, which is the Ministry of Education, .gov.my. So this is a very good strategy when you want to search the whole government website, because you're not sure, whether this data belongs to any specific ministry. All right. And so you want to make sure that you search all the government websites, then you can use gov.my, right? Other countries, for Singapore, would be gov.sg, right? Then you do file type PDF. This is because you believe that the data is in the PDF. So maternal mortality rate. I can make it more specific by using double quotes. So you see that we have only 500 results, and this is general health status, maternal and child mortality. I think this will give me the data that I want. So let me see. This is a report. It's 2014, so this is not the latest report. So I don't want that. So probably I'll put another keywords 2020. Okay, I have 2018. This one, yeah. I don't think Malaysia has 2020 data yet. So probably I'll do 2019. This is a 2018 report. So let me see what report is this. It's very slow. Let me see other. This one could be interesting. Statement by Director General. Oh, this is, I think it's a statement presented to a international commission in New York in 2019. Right, so I'll just search for maternal. Oh, interesting, I can't find it. You have life expectancy rate. Oh, interesting. This PDF is not searchable because it's, I think it probably is a scan copy or the photograph. Okay. What about the other report? Okay, this Malaysia Healthcare at a glance. So if we know that there's a report called Malaysia Healthcare as at a glance, right? We can do that as well. So I can okay, sorry. I can still keep the mortality rate and then I'll do, there's only 2018 report. Oh, interesting. There's no 2019 reports. There's a 16, 17, 18, but there's no 19 report, right? So you need to continue. I need to continue to search for the 2019 results. So I still go back to this one and look at this. Yeah, I think I have the results here. The annual report. Oh, this is 2017. No. So guys, just have to go continue to search from 2019. So probably I will remove the PDF so that I don't want to look at PDF because the data could be in a website as well. I think this is the one. This is the annual reports of the Ministry of Health. Yep, MMR is maternal mortality rate. Okay. It is until 2018 only. I think probably the latest data is 2018. Right, so this is 2019 report. Oh, probably I can look for, so this is how I would search. I will look for the Laporan Tahunan KKM. So I would look for this keyword. But I will look for 2020. No such search term. So my luck is not very good today. Right, but just to demonstrate to you, this is how I can narrow down my search. Because if I remove this site, right, I'll just put, sorry. I'll just put maternal mortality rate 2019, and I'll just put Malaysia. Guess what I would get? I will get ResearchGate. This is a scientific paper. I would get from the university, UPM. I would get from, I'm not sure what is this, Cochrane Library, right? Statista, but I won't get it directly from the government, right? So if I want to get the government, I should specify that I want to get from the government, right? I can be more specific by doing .gov.my, moh.gov.my. So I will be looking all material from moh.gov.my only. Okay, right? So if I do gov.my, I will get more, I will get like academicscience.gov.my, right? The other thing, okay? Anyone want to share your experience with us? I'm trying to open up the chat box. Okay, we have only 3 minutes to finish these sessions. Any questions so far for the whole session? Any feedback? Am I going too fast, too slow? Any other thing you want me to cover in the next sessions? You can tell me now. No? Okay, then I will just finish the last thing. is called extracting data. So if your data is in format like spreadsheet, CSV, TSV, XLS, right? You don't have to convert it, right? You can straight away open it with a spreadsheet software. This is what we call a structured machine readable data source. Okay, is in an organized format. You can parse means that you can process it with data software. Okay, the most common type of data files are CSV, TSV, XLS, XLSX. But you have database files. This is more complicated. You have XML, MDB, SQL, POR, right, and geospatial, right. But usually we just deal with the spreadsheet, right. However, if your data is in unstructured, non-machine readable format, which means PDF file, document file, right? Document file is also, you can't do analysis as well, right? Because you open it on Microsoft Word or OpenOffice Word, but you can't analyze it, right? You need to convert it into a spreadsheet, right? Or you have something from image, right? JPEG file, PNG, this kind of file that's scanned, like the one that I show you is a scanned copy of the file. You can't open up with the data software, then you need to convert it, right? However, if you have the scan copy like this one, there are some tables, some data, right? Scan copy, there even some changes to the data, right? Like cross it and then write a new value. This kind of document is very hard to convert, right? You have to use OCR, which means OCR software to convert it. But if you have a PDF, this is the common type of PDF, right? It's computer generated, is generated by converting a Word file into a PDF, right? So you have all this, but the data is inside here, right? So there's no way for you to automatically extract the data, right? The best bet is that you need to get someone to manually pull out the data from here. So this is no, we can't do the conversion. The last one, this is what we can convert, right? If there's a table, it's a table structure with the data, right? And it is computer generated, which means that it is not from a picture. It is not a scanned copy, but it is a copy from the Word file or the copy from Excel, just that they save it as a PDF format, right? This is the file that we are able to convert, right? And to convert it, there are two tools that I recommend. One is called Tabula. The other one is called Comet Docs, right? Tabula is a free software. It's called tabula.technology, the website. You can download, it is available for Mac or Windows. And then you can you can import your PDF and select the table and convert it into a spreadsheet, right? It's very easy. I don't even have to show you here because it's very easy to use. You just have to drag, select the table and click convert, and you will get the data on spreadsheet, right? The other one is called Comet Docs. Okay, cometdocs.com. For Tabula, because you download it on your machine, on your laptop, you can convert the file offline, right? But for Comet Docs, you have to upload your file to this website and then convert from there. Again, it is not that hard. Just upload a file here, and then you click convert. And wait, they even have a tutorial for you. Right, you get convert. You download the file here, drag your file to this box, and then you can choose how to convert it. Okay, so this is the online tools. This one has a paid. You need to pay if you exceed, I think, 500 files or 500 megabytes, right? If you register for the free account, then you can convert for free for limited numbers of documents. For Tabula, it is totally free. No matter how many documents you want to convert, it's totally free, but you have to download and install it on your laptop. Okay, this is developed by a bunch of journalists, so they make it free, right? This is a commercial product, right? So there are other tools out there, but I recommend these two tools because they're very easy to use and Tabula is free. Okay, and before we finish today's sessions, just to show you this comic, that when we use data for reporting, remember to use data responsibly. Okay, this is a joke, right? Let's say that this women get married, right? So this guy say that, as you can see, by late next month, you have over 4 dozen husbands. So better get a bulk rate on wedding cake, because yesterday you got married, right? So I extrapolate it tomorrow. Today you get married, then tomorrow you will get another marriage, and in next month you will get 4 dozens of husbands, okay, number of husbands, right? And there's a article that I strongly recommend that you should read it. It is about how do you use data carefully and responsibly in your reporting, right? Although this is on COVID-19, but you can, the same concepts apply for any other health reporting. Okay, this is some of the charts here, right? Because there are a lot of uncertainties. So remember that when you are writing a story based on health data, try to explain that, those are estimates or there are some uncertainties within the data, okay? So that your audience understand the story as well as, some of the uncertainties in those data. So guys, that's the end of our sessions. You can download this deck from this URL. Let me copy and put it into the chat box. Okay, this is today's deck. For the next sessions, I would also put the deck online and you can download it. Okay, before I finish everything, any questions? You also feel free to contact me if you have any questions about any data or any stories, right? We actually have these cleaning hours coaching sessions after the workshop. So probably Junie or anyone want to share on that?
Sure, yes. Thank you so much, King, for that COVID-19 and public health data storytelling. This was the first session out of 3 that King will be delivering. Today's one was about finding reliable data sources. So don't forget to sign up for the next 2 sessions, which are coming up. The next one is called Data Story Recipes, and the third one is called Storytelling with Data Visualization. Those are taking place in the next couple of weeks in English and as well as in Mandarin in the afternoon. You can register the links there. And like King mentioned, with regards to the one-to-one coaching, there is also a sign-up link there and also on the website. These sessions, you can come as an individual, or if actually you're highly encouraged to come as a team if you are working with a team of colleagues. Your colleagues need not have attended these sessions, but of course, we encourage those of you who are registering, at least one person has attended King's webinars during this period. And then take the opportunity to get his advice and his guidance. We actually have an open call right now for the Asian Digital Media Awards. So, one of the categories is data visualization. So this would be a very timely, it wasn't planned this way, but this could be a very timely opportunity to work on a great data project with King's guidance and then submit them for the awards. The closing date is 2nd of July. And also related to this is the last webinar in our Data Garage series, which is all about data privacy in managing subscriptions, what you need to know about protecting personal information. So this is a topic which has not really been discussed much at all. And I'm sure a lot of you companies which are managing mailing lists and other confidential data of either your subscribers or your registered users. So this webinar is all about the acquisition, handling, and deleting of personally identifiable information, cross-border concerns about free flow of information, and it's also related to cybersecurity and possible hacking, the role of AI as well as we automate more and more of these processes, as well as the impact of regulations such as the European GDPR, as well as legislation such as in Singapore we have the PDPA, or the Personal Data Protection Act. So this is a very interesting session that we'll start with the first half with training. And then after that, a panel discussion with speakers from Philippines, Malaysia, and Singapore. So, please register and encourage your colleagues as well to attend. And I will see you at next week's webinar. Bye-bye for now.